Hello everyone. So again, I'll be discussing some of the INICET November recalls with you. So as told by people amongst you all only, this was the ECG as they have told me. A young female was having fatigue after exercise, and ECG is shown as below. What will be the diagnosis? And ECG was showing some epsilon waves at the J point. So these epsilon waves represents ARVC, and ARVC, as the name suggests, it's arrhythmogenic right ventricular cardiomyopathy, but it can also involve left ventricle as well. And there will be dilatation of LV and RV along with the foci of arrhythmia. HOCM में क्या होगा? In ECG of HOCM, you will be seeing these high voltage QRSs in the chest leads, and the criteria of LVH will be there. Along with there will be deep T wave inversions in V5, V6, and in V1, V2, there would be a tall R wave. What will happen in DCMP is there would be a low voltage complex, there would be poor progression of R waves. In atrial fibrillation KCG, may you all know that there would be RR interval irregularity and P waves would be absent. So you can tell if this ECG is there or not in the comment section. If there would be LVH criteria fulfilling and deep T wave redundancy in V5, V6 and tall R in V1, V2, then it would favor HOCM. तो अगर ECG में वो था, then the answer would be HOCM. If this would be the ECG, then the answer would be ARVC. Coming on to next question. Most common tests used in screening of neonatal hearing loss. So we all know that autoacoustic emissions are the screening test for neonatal hearing loss, and BERA is the definitive test. So the answer is autoacoustic emissions. Which of the following conditions saw maximum hearing loss? So it's a question, repeated question, and क्यू बैंक में भी बहुत बार ये हर जगह ही दे रखा है क्वेश्चन. एंड हम ऐसे ही पढ़ते थे कि अगर ऑसिकुलर डिसकंटिन्यूटी है बट टिम्पैनिक मेम्ब्रेन इज परफोरेटेड, तो डायरेक्टली कंडक्शन थ्रू एयर कैन हैपन. सो उसमें हियरिंग लॉस कम होगा. बट इफ देयर इज ऑसिकुलर डिसकंटिन्यूटी एंड टिम्पैनिक मेम्ब्रेन इज इंटैक्ट, then there would be a much more hearing loss. So answer is C, ossicular discontinuity with intact tympanic membrane. So it sounds like a paradox, but the concept here is if the tympanic membrane is perforated, the conduction can directly happen through the air. Amongst the nerve injuries which is life threatening, so वैसे तो you all know it better than me, but concept is bilateral nerve injuries are always dangerous. One thing, क्योंकि यूनिलेटरल होगी तो एक ही तो आपका जो वोकल कॉर्ड है एक ही डिस्प्लेस होगा, या सेंसरी लॉस होगा तो एक साइड होगा, तो अदर साइड विल कंपनसेट. एंड द थिंग इज कि इफ देयर इज अ बायलेटरल रिकरेंट laryngeal nerve injury, तो abductors चले जाएंगे. Abductors चले जाएंगे तो योर vocal cord will be like this, sit like, so you won't be able to inspire properly and there will be a stridor, so you immediately need a tracheostomy or else you can die as well. So the answer would be bilateral recurrent laryngeal nerve injury. Croup is caused by, so croup is tracheobronchitis, and the most common cause is parainfluenza virus, then influenza virus. So if the parainfluenza virus is not in the option, then the answer would be influenza virus. Which of the following drugs binds to CD4 receptor and has both CXCR5 and CCR5 activity? So this monoclonal antibody, that is ibalizumab, it binds to the CD4 receptor and has both CXCR5 and CCR5 activity. So the answer is ibalizumab. Ibalizumab is a new drug for HIV, and it's a frequently asked question in GTs जो आपने practice किए होंगे as well. Now, which of the following is not included in AMTSL? So the options are uterine massage, we gave it, yes. CCT, yes. Administration of oxytocin immediately after delivery, yes. Bimanual compression is not given in AMTSL. It is a part of um, algorithm of atonic uterus. Now, shortest AP diameter of pelvic inlet, it's a very common question and it's a direct question, one liner. So the answer is obstetric conjugate, we all know, and we have all studied it. Now, mitochondria of spermatozoa forms. So we know different parts of spermatozoa are formed by different components, and mitochondria forms the connecting part. So अभी तक जितने भी questions we have discussed, we can see that there are the more questions are one-liners, and it was the paper was a little on the easier side. Now coming on to the next question. So which is not seen in TTP, and जैसे कि options मुझे पता लगे, these were the options. Maha, yes, it is seen. Thrombocytopenia, yes, again it is seen. Renal failure, it is seen. And thrombosis, it is seen. So all four are seen in TTP. Now I don't know if the options are wrong. You can just tell me in the comment section, or maybe the question is wrong, or maybe this, and we would be considering more correct answer in this. But you can tell me in the comment section. Now, another question is breast cancer की staging. So, अभी in surgery, breast cancer, oral cancer, and lung cancer, ये stagings are frequently asked. उसमें breast cancer is the most easiest one thing, and it is again आपके UG days में भी in your exams, practical exam, breast cancer का केस सबको मिलता है, तो इसकी staging तो in and out पता होनी चाहिए. तो it's a easy question. The breast cancer है size is 6 into 7 centimeter with dimpling with invasion of pectoralis major muscle. तो अगर pectoralis major invasion भी हो रहा है, it doesn't affect the T stage. Now the size is 6 into 7, so T would be T3, and there is ipsilateral matted axillary lymph nodes. Since there are matted lymph nodes, it would be N2. So the stage is T3 N2. Okay. Now if you can remember more questions, you can just tell me in the comment section, and it would be really great if you can tell me the recall questions of medicine also. All the best.